Sun salutation. Start with your arms down by your side. Rotate your palms out as you bring your hands over your head. Your palms together over your head. Bring your hands in what we call prayer position in front of your body. If your mind is busy, you can settle your mind using a mantra. We don't have to be super spiritual to use this. May I think kind thoughts. May I speak kind words. May my heart feel kindness. This happens as you exhale, and as you inhale, turn your palms out and bring them over your head. While I speak, you can begin your practice by noticing the path of your breath. Wherever you are, notice what is completely. Begin to feel your body being breathed. Begin to notice the state of your mind and invite your attention to be here now.
My last appointment with my doctor at the concussion clinic, she was like, "What is your acupuncturist doing?" He describes it through the terms of Chinese medicine. So it has to do with balancing qi, energy, etc., etc. And she just looked at me and it's like, this is effective. If this was not effective, if this didn't work, then the allergies that I've had for the past 54 years of my life would not have suddenly dissipated. Molds used to be huge for me. I couldn't tolerate any mold, and I was allergic to all the psyllins as well. My sons had dropped a couple of jackets, forgotten about them. They sat in a corner. They absorbed dampness. They got moldy. He gave them to me to take home. "Mom, can you fix these?" Under normal circumstances a year and a half ago, I would have picked those up and immediately had an allergic reaction. And I've been working on them for a couple weeks now, and I haven't even had a sneeze. Wow. Nothing.
My idea of wellness is living in balance in one's body, mind, and spirit. The 3 stages of work that I offer people to come into balance: heal, sustain, and thrive.
Now don't step on the flaming point. Yana wana yana away ho hanna. Yana wana yana away ho hanna.
I'm all about the story, so let me start with my story and then tell you how I got to the story. I was a lowly young member, 26 years old, but I had a master's degree in health administration. They said, "Little girl, come over here. You're our new CEO." Acting, of course.
Unfortunately, we're able to make really large financial mistakes these days. So people come in wanting to know, are they on the right track? What's preventing us from getting what we really want? Generally, it's habits, it's emotions that are getting in our way. We track our expenses and we start to have plans and goals about how we're going to move forward. These are things that I help people do through simple, bite-sized pieces.
For me, wellness is a complete approach to my physical, my spiritual, and my astral body, and it's a practice.
Research shows lifestyle choices can really help prevent chronic diseases such as heart disease, stroke, type 2 diabetes.
I'm an acupuncturist specializing in NAET and Nambujapad's allergy elimination technique. I'm going to be speaking on various paradigms relating to traditional Chinese medicine, as well as diagnostic and treatment methods. Acupuncture has been used for thousands of years for the treatment of just about anything.
Love your body, take control of your time, steward your finances, tune into your intuition, balance your mind, and calm your emotions. Teaching Ithaca Wellness.
Neo-Confucian Mencius. So he had this idea, if you consider the basic principles, when you have proper conduct and proper relationships, then your energy flows freely, and you're tapped into the universe. You're channeling this energy into your daily life. People's conduct and how they behave in life can be a source of great abundance or great stagnation. In Chinese medicine, we have three forms of pathology, you can say. One is if you get hit by a car or truck, which is trauma. Another is if you have pestilence or some sort of invasion, what we call wind cold or wind heat. In modern medicine, we viruses and bacteria and pestilence. Third one is emotional imbalance. Ancient texts, the Shanghai says, where there's pain, there's stagnation of qi and blood. There's blood stagnation, qi stagnation, damp stagnation, cold stagnation, heat stagnation, phlegm stagnation. So all these stagnations can be caused by any of the those three methods I mentioned. 19th century, Chinese medicine had gone to disrepute in China, and under Mao Zedong, the Cultural Revolution, on the upsides, is that Chinese medicine was revived. They took certain paradigms. There were some family paradigms or ways of treatment that were lost, but they took the basic paradigms out of the ancient texts.
I began with Dr. Hackman in November. I originally came because of my allergies. Gosh, since the time I was a little girl. What started out as a very basic allergy, over the years, it just got worse and worse and worse. And there got a point where my sulfite allergy just went over the top. I became like sensitive to everything. And I would have like severe reactions. I would have hives, all the rhinitis that goes with it. I would have severe like migraine headaches. I had controlled it pretty much by reading labels on everything and use of an antihistamine. But I was like, there's got to be something more. I was reading everything on the internet, and I Googled allergist, and General C Clinic came up. I thought, my gosh, he's right here in the same town, and he's trained in this allergy elimination technique. Let's give it a shot. So I started coming in November, and I honestly have not taken an antihistamine. I'm eating things that I haven't eaten in years, like mangoes and peaches and, you know, all kinds of things that used to trigger my allergy. And then I had this car accident in December, sustained a concussion. I've been having post-concussive syndrome since then. I go to the concussion clinic, I go to a neurologist, I go to a chiropractor, I go to a massage therapist, and I've been going here. The healing process has been slow because it took a really long time to unkink everything from the whiplash. This whole area was like, just like solid from holding up my head.
This tongue is a very accurate, clear diagnostic tool. Things you're looking for on a tongue is the size of the tongue, if it's big, if it's narrow, if it has teeth marks. If it has teeth marks along the side, you know that has qi deficiency because the qi isn't regulating fluid metabolism. The tongue swells up and presses against the teeth, so you see these scallops. And then if you see a crack in the center, it usually indicates qi deficiency. If it has lots of little cracks, that shows fluid deficiency, kind of dehydration, yin deficiency we call it. If the color is purple, then there's blood stagnation. If it's pale, it shows blood deficiency. If it has like red, it shows heat stagnation. If there's a red tip, it means hot fire. So different parts of the tongue are related to different organs also, so you could narrow it down even further. If there's a lot of thick coating, that shows damp stagnation. And oftentimes you'll find if the qi is weak, you'll get damp stagnation. Damp stagnation will block the fluids and the qi, and then you'll get more qi stagnation. We take the pulse. The pulse, there are 3 positions: lung, spleen, and kidney, also known as metal, earth, and water. So we have 3 depths. The kidney is the deep point, and that's the yin pulse on the deep level, and the upper level is the bladder, also water. So in taking the pulse, there are 17 common pulses. We're looking for the strength of the pulse, the depth of the pulse, how tight the pulse is, the quality of the pulse, if it's rolling, if it's tight. The left hand has different pulses: liver and gallbladder. That's the first, which is wood. First pulse is heart and small intestine, which is fire. Last pulse is kidney, water. So as one would imagine, a person who's just had a headache, her pulses are pretty weak because it takes a lot of energy to deal with that kind of pain. That's for a traditional diagnosis. Now she has a headache and her pulses are weak. Her tongue is kind of big, has a thin coating, slight crack in the center. So basically we're thinking this headache is from deficiency, but also because it's a concussion, so we're thinking that by opening up the channels we'll be able to bring in more qi and help heal the trauma. When treating with NAET, we do this also because, like for someone who has a traumatic injury, we're helping taking a load off the system so there's more energy. Dealing with things like allergies of different sorts takes a lot of energy, and if we get rid of those allergies and stuff, she'll have more energy to heal. So these vials are actually water. We didn't take a bunch of grass and stick them in there. Every substance has a unique vibration. The computer generates the vibration and transfers it into this water. This is muscle testing. You point your thumb to the big toe. We're creating, large intestine channel comes to here, and the liver channel is at the big toe. We're creating an energetic circle of all the 12 meridians. So she resists a little bit. If the arm goes down, that's showing yes. So any foods, anything that's ingested, anything internal to the body, anything that's being worn, anything in my basic boxes, anything in basic box, other box, box 2, box 3. So we go to box 2. You can just ask these questions. So besides treating for the two glands, the pineal and the pituitary, I'm going to treat with RNA and DNA, which help bring it to a deeper level. Whenever someone has a head injury, they're going to damage their pineal gland, because just even if you bang your head, you can shake it up, and that'll help disturb your whole hormonal balance. Doing NAET is part of this clearing. You have to do regular acupuncture before you do the NAET, otherwise it'll interfere with the NAET clearing. Now, there are many paradigms that I could be using to decide which. I'll discuss them later, but in this case, I'm just basically strengthening. You're just picking different points that strengthen and do it. And that's why I'm doing it. But there's more elaborate ways, other systems. I could be thinking along 5 elements if I wanted to tonify. So I'm picking the Sanjiao 3 point because it goes up into the head. I'm picking points that are distal points that will be going up and helping open up the energy. We say the brain is ruled by the kidney. And these needles are all sterile. You use them once, throw them away. Everyone's concerned about sterility. And the stomach channel goes up into the head. That's why we choose that. And it particularly affect digestive fires and things. This point here is the kidney. Now I'm doing some craniosacral. I find it's very useful because right now I'm opening up the channels from distal points, and at the same time I'm facilitating the movement in the brain through the cranial work. The allergy clearing, which I'm going to do later, is typically it's not part of the Chinese paradigm, but it takes certain principles of Chinese energetic medicine. A lot of practitioners use the 5 elements, some people use 8 principles, some people use the 4 depths. Say with the 4 levels, say if you get sick, a common cold. So the Wei level is the superficial level when it first invades the body. After it passes through that, it goes into the Qi level, which would give you like stomach pains and greater phlegm. If you went in deeper than that, you'd have Yin level, which is your nutritional level. And then if you went in deeper than that, you get into blood stagnation, which could also include things like emphysema, cancer, severe diseases. If I wanted to be treating her now according to the 5 element theory, it'd be a point on the spleen channel, which is the earth channel, so that we call that an orrery point. You can activate the whole spleen channel to strengthen her spleen. or you would use a fire point, spleen 2, on the earth channel to strengthen the spleen, because fire is the mother of earth. Or if there was some stagnation, reduce earth would use the middle point on the spleen channel. Every channel has 5 elements to it, and each organ and channel element also has an emotion. So that gets down to the whole idea of emotions being the emotional imbalance being a big problem as a pathogen. I tend to treat more according to 8 principles. 8 principles: is this an internal or external problem? Is it excess or deficient problem? Is it hot or cold? And yin and yang sort of defines all the others as well, because they're all in dynamic tension of yin and yang. Chinese herbal medicine is also based in 8 principles. Herbs that are hot-natured and cold-natured, herbs for moving damp, herbs for strengthening blood, herbs for reducing blood stagnation, herbs to tonify qi, herbs to reduce qi stagnation, herbs to clear phlegm. Chinese herbal medicine, which is somewhat different than Western medicine, because Western herbal medicine you tend to use individual herbs for specific things. Say they would say this person has damp stagnation, they have a common cold, so you would say, well, is it a hot cold or a heat cold? You'd use cold herbs that clear damp. If you have sinus congestion, you would add particular herbs that go to the sinuses. If I were treating her with herbs, I would use something like Sibu Tang or Bazenwan. Bazenwan is a mixture of Sibu Tang, which are 4 herbs for tonify the blood, and 4 gentlemen, which is 4 herbs to tonify the qi. For those interested in craniosacral, first thing I did was release the occiput, raising the frontal bone to take pressure, decompress the different bones of the skull. Different bones of the skull, people tend to think that you have this solid skull, but actually the skull doesn't fuse until you die. It has all these different parts, the occiput, the frontal bone, the parietal bone, the temporal bone, that have organic matter in them, and they have like micro movement to them. In China, up until the imperial dynasties from like 1100 to like modern times, you had what was called the examination system, and it was developed by Chu Xia, Confucian and Neo-Confucian in the Song dynasty. And a big portion of this was based on this diagram of the Supreme Ultimate, picked up by Sheng Yi. I'm not really clear. I think he was a Neo-Confucian, but the diagram itself was a Taoist diagram. And in this diagram, you have Wu, the beginning, you have emptiness, and then you have creation, Yu. And then you have the differentiation into yin-yang, and then you have 5 elements. This is not just a creation story, it's what's happening right now as our energy moves from an energetic level into a manifestation of physical form. The ancient Chinese had this already, and this is sort of somewhat similar in some respects to modern day quantum physics. The idea of the subtle vibration of energy becoming a more dense vibration and manifesting into physicality. So in doing the allergy clearings, how we would explain the energy in the vials, and how that can affect the physical so dramatically. So when we're doing tonifying, generally speaking, in the Chinese method, tonifying is accomplished either through needle manipulation or time. 10 to 15 minutes is tonifying, and 25 to 30 minutes is reducing. If this was a Japanese style or 5-element style, they would be doing 5 minutes tonifying and 15 minutes is reducing. Now we're going to do the NAET clearing. Okay, put this in your hand and look at your arm. First you put these 2 fingers together. So the first level is physical level, chemical nutritional level, emotional level, So she goes bad on all of them. So this allergen is affecting all 3 levels. So you now roll over all these 3 fingers together because those are the levels that are being affected. And breathe in, hold breath. Breathe out, hold out. Rapidly, hyperventilate, and relax the breathing. And roll over. We do the needles, the same basic 8 needles to open up the channels. By going up and down the spine like that, while she's holding the substance that she's intolerant to, we're creating a new energetic relationship. So instead of feeling negative energy in response to the allergen, she's now feeling a positive energy. Because you went up and down. In Chinese medicine we call the Wato Jiaji along the spine. In Western medicine we would say it's the central nervous system. We're just energizing it by stimulating the under each vertebrae. So this creates a new energetic relationship, and we do these points to open up the channels to communicate the new relationship to the whole body, and then have her avoid the substance for 25 hours, because every 2 hours a different organ is dominant. And we want each organ to experience the new relationship while it's dominant. So she avoids the substance for 25 hours, and then she's no longer intolerant. In this case, since there are glands that we're treating, and it's all internal to the body, she doesn't have to avoid anything because you can't avoid your own glands and organs. So now she lays here for 15 minutes.
I saw the massage therapist and the chiropractor. They both said that they felt the majority of the effects of the whiplash had dissipated, that whatever was going on now was internal to the brain.
Yeah, well, the cranial work we do also do a lot of unwinding of the neck, so that helps to release the tensions on the spine. That helps. A lot of times the chiropractic treatments will hold better, or you don't necessarily even need them sometimes. It just the muscles will relax and the body will self-correct. So everything basically that I was talking about, different paradigms and different treatment methods, is what you learn the first year of acupuncture. Things, and I just sort of scratched the surface. There are several other paradigms I could talk about. So there are a lot of points that are good for just specific things. It's like spleen 9 is known for clearing damp if you have damp stagnation. Lao Zen on the hand is good for waking up with a stiff neck. An Mian on the neck is good for insomnia. Then you have points like in the upper chest, kidney points, which we call the Chang channel because it runs along the kidney channel, but it's an X meridian, and they relate to different spirit points. We have several microcosms of the body. Like the nose, you have all the organs represented on the nose, you have all the organs represented in the eyes, you have all the organs represented in the ears, and the hands, and the feet. Reflexology is a system of the feet, but Chinese medicine does not use, doesn't come from China. But craniosacral, I always do still point in the beginning and the end of doing the various manipulations of the head. Every 8 to 12 seconds, the body opens and closes energetically, and the different bones of the skull have micro movements. So I do the still point on the occiput. You shut down, put a little bit of pressure, and you shut down the cranial rhythm, and then it reboots and helps reorganize the whole body. Treating like traumatic injuries. Say if she had sciatica, which she did at one point. I use a lot of electroacupuncture, so I would put needles in points of pain and points along the channel, and then hook up some electricity or burn some moxa or use some cups. There's also other treatment modalities with acupuncture. Some people might say if you had a shoulder pain, They might treat your hip because there's a similar shape and structure to the two. Or if you had a shoulder pain, they might treat a knee, an opposite knee, or vice versa. If you have a knee problem, they can treat your opposite shoulder. In sports medicine, we have something called the 4 gates. Also, you could do opposite sides. Say you banged your foot and you don't want to stick a needle into it. You could treat the same point on the other foot. So in this instance, I'm closing all the holes because we're doing the even work for the most part. If I was reducing some stagnation, I would leave the holes open. If I was strengthening more, I would maybe manipulate the needle a little bit, going inward, or flicking it. But in this case, in NAET, we just mostly open the channels and do even work. These are on. So, I'll have you do it. First 2 fingers together, thumb and the middle finger, thumb and the ring finger. Very good. Have these vials and rub your hands together 30 seconds. So she was good on all 3 levels. She's strong now. So you have rectified the imbalance in those glands, and they should function better now. And that is an acupuncture treatment with NAET, allergy elimination, and craniosacral therapy.
My massage therapist was suspicious that it had something to do with the sphenoid bone, which is the bone that separates your sinuses from the rest of your brain. But it also protects the pituitary. My chiropractor and my massage therapist are saying, and was what he's been treating, I can go back to the concussion clinic this time and say, it's not my neck anymore. I think what Dr. Hackman is treating is probably part of it. I think my massage therapist has a little piece of it too. It could be a very subtle movement of that interior bone that may have caused something. Because I didn't tell one about the other, and they both said yesterday that probably most of what was in the whiplash has been resolved, and it's something internal to the brain. And he found pineal and pituitary this morning. So, like all these things fit together and make sense. My hardest person to convince has been my doctor at the concussion clinic. They were insistent that these recurrent headaches were coming from all the result of the muscle strain from the whiplash. And of the 33 headaches I've had since I had the accident, there were 4 of them that were 2-day headaches, and this one was the 5th. My son got really angry because he went with me to my last 2 appointments up there, and he was like, you don't understand. This is my mom. She's had a career in social work. She has a master's degree. She's highly organized. She knows where everything is. And what you've got in front of you is a doddering lady, and that's not my mom. That's not how she's been. They took me away from the nurse practitioner at the concussion clinic, and they're scheduling me with the director of the clinic.
Voices and hearts come to sing together.
I'm an essential oils consultant and coach, and I teach about using very high-grade therapeutic essential oils for health and wellness. Anyone who's interested in natural health care or prevention lifestyle or non-pharmaceutical solutions for health, mind, body, and moods may benefit. Oils that I don't like the smell of, I put them on my feet. I put my socks on, and I want the benefit of the oil. There are certain oils that I do that with. When I first smelled them, and I was just like, ooh, but I think I really need this. And I kind of warm up to the smell over time. When we talk about managing stress, it's really important, of course, to look at what causes the stress in your life. And what's fascinating is how many oils have similar properties and how one oil can have so many properties.